Now, let's welcome Shannon Mathis of Novant Health Gastroenterology. Shannon, thank you so much for joining our show today. It's a pleasure to have you here.
I'm happy to be here.
Great. So we want to start, as we do all of our interviews, by learning about our guest, a little bit about their education and their background. So tell us about that.
I went to nursing school at Barton College in Wilson, North Carolina.
Wilson, North Carolina? Really?
Small private school. Worked for a nurse for about 5 years at the bedside in a variety of areas, med surg, a little bit of orthopedics, some women's health, plastic surgery, before deciding to go back to school to become a nurse practitioner. And I got my master's in nursing through the University of South Alabama in Mobile.
Nice. So did you always want to be a nurse practitioner, or was that something that you just sort of grew into?
I really love taking care of patients, and in the acute care setting at the bedside, you take care of them for a much shorter time frame. And so I really enjoy having that relationship with my patients and being able to follow up with them and see them through. And so that is really what pushed me to further my education and become a nurse practitioner, to allow me to have that deeper connection with my patients.
That's awesome. Well, you do have a lot of experience, and you've already told me how you how you lean toward the nurse practitioner. So you've recently joined Novant Health Gastroenterology, correct?
Yes, ma'am.
So what interested you in that specialty?
I think the GI specialty touches a lot of people, whether they realize it or not. From day to day, I think at some point or another we've all had a GI issue.
Of course.
Unfortunately.
We don't like to talk about it, but
right,
we all
it's not
have
always
it.
the most fun, but I think, of course some people have worse issues than others, and quality of life associated with those issues can really be affected. And I think gastroenterology allows you to help people improve the quality of their life. In that manner, at least, it makes a big difference for those folks.
That's true. I never thought about it like that, but you're absolutely true. Having been there myself several times, I truly get what you're saying, and it makes a big difference.
It really does.
To be healthy in that.
Right.
aspect.
Even, something as simple as heartburn, someone that suffers from heartburn on a daily basis.
You can't eat what you really love.
Right. So, it may seem simple to some, but for others it has a big impact on their life.
Right. And medicine only goes so far, and then you have to start looking elsewhere. But so you're in the clinic there at Novant Health Gastroenterology, and so tell me a little bit about that clinic and your role at the clinic.
So typically when I say we, there are other, another nurse practitioner and PA and our doctors, of course. We see patients in the clinic, of course, from screening colonoscopies to patients with gastrointestinal complaints, from GERD to, abdominal pain, a wide variety of things. But recently we've also had myself and our other nurse practitioner and PA have started rounding in the hospital on our inpatients population as well. So we're getting to see a wider variety of things and being able to provide care for our patients in both settings. As I'm sure you know, we have the endoscopy center attached to the office as well. So our screening colonoscopies and our endoscopies patients are right next door most of the time having their procedures done. So we kind of try to keep them in the same place so that they feel comfortable and at home and know who they're working with.
Well, that's really exciting that you're seeing patients in the hospital. I think that's awesome, because oftentimes those types of patients end up being in the hospital after having been treated in your office at some point. So you already have that relationship, and then for you to follow up with them in the hospital, I think that makes a world of difference.
Definitely.
And it eases their
Right.
anxiety.
I think they're familiar, they're comfortable with us, or we may obtain new patients that way. Patients that have had an acute issue that we can follow and help them manage long term.
So as far as your role in the clinic, then do you see like a lot of the new patients that come in like prior to their scoping?
We do. I do right now a lot more so because I'm newer to the practice, of course. So we kind of try to ease in and see a lot of the newer patients, just get them established, point them in the right direction, make sure they're getting what they need. So that does make up a majority of my patient population right now.
And speaking about the clinic, where is the clinic located?
We are on Highway 17, just past Novant Brunswick Hospital. Our address is 13 Medical Campus Drive. We're kind of situated behind the pharmacy. There's a little strip in front of our office there.
There's a big medical building across the street from you. It's a Brunswick Medical Park.
I think so.
So
kind of tucked away.
Yeah, it is kind of tucked away back in there. And so your office is right next to your endoscopy center.
Yes, ma'am. We're physically attached.
And that endoscopy center is something new to Brunswick County. It's been there about a year.
Yes, ma'am.
But it's a very pleasant experience to go there rather than to the hospital for a scope.
I think it's a lot less intimidating than having
so.
to go to the hospital for patients. And we have a great team over there, from anesthesia to nursing staff, our physicians. Everyone works very, very well together.
Yeah, I actually have had the opportunity to visit the endoscopy center.
Good.
And so I know firsthand about how it just feels much better. It is a great, it's a great facility, and everyone who works there is just very nice and friendly, and it just feels different than the hospital. So I think people will appreciate that more. So tell me, do you have any special medical interests other than gastroenterology, of course?
I'm really enjoying learning a lot more about irritable bowel syndrome, inflammatory bowel disease. Again, because those types of problems really impact quality of life for our patients, and being able to help those patients ensure and manage those symptoms so that they can live their best life is really fulfilling. They're very appreciative, and it may be something they've dealt with lifelong that they've never had addressed, or they just thought that's the way that it was, and it doesn't have to be that way. So I'm really enjoying that aspect.
That's great. So what is your favorite part of your job?
My patients, for sure. All of our patients. I really enjoy interacting with them, developing that relationship, building that rapport, and being able to follow up with them.
Sometimes your gastroenterologists, you will see them as often as you see your primary care.
Sometimes.
If you have those such situations. So I think it's important. Relationships are important.
Oh, yes.
And because it's a very intimate kind of exam.
It is.
And so you have to be really comfortable and trust your provider.
I agree, and
for those services.
I think if patients are comfortable with their provider, they are more apt to open up and really, share their experiences and allow us to help them the best that we can.
Yeah, oftentimes people don't tell you the truth.
Unfortunately, or it's embarrassing, or
it's just not an easy conversation.
It's not always.
Well, we're really happy to have you here in the community. How are you enjoying the area so far?
I actually moved to the area a few years ago. I grew up in North Carolina, so
that's true.
Being on the coast is newer to me,
Sure.
But of course that is a plus. Love that. I grew up kind of in the middle of nowhere, not much to do, so it's been a very nice change.
Well, the people of Wilson won't appreciate that.
But it's been very, very nice to be out here on the coast, for sure.
That's awesome, and we're really happy to have you here. So if our viewers need to get in touch with you or need to make an appointment at Novant Health Gastroenterology, how might they do that?
They could either check the website, of course, novanthealth.org, and request an appointment online, or our direct number is 910-754-5988. Referrals from their primary care providers will also facilitate appointments for them. So there's a number of ways that they could reach out and get set up.
Is a referral necessary?
No, ma'am. Not necessary at all.
I wanted to get that out there because I didn't think so. Well, it is a pleasure to have you. I hope you'll come back and let us know how things are going for you.
I would love to do that.
We're happy to have you in the community.
Thank you. I'm happy to be here.